Are you a nurse? Do you make difficult decisions at work every day? Are you sometimes forced to make choices with which you do not agree? You may be suffering from what researchers term moral distress. Tune in to this news broadcast as our team of student theorists have gone to great depths to explain the background and significance of moral distress, its meaning in published works, its purpose, definitions, and defining characteristics, various cases, antecedents and consequences, and empirical indicators and operational definitions. Don't miss out on this opportunity to increase your knowledge base and improve your job satisfaction. And now, let's travel to Lafayette with Miss Malie Ruin.
Meredith. And now, folks, I'll tell you a little more about the background and significance of the concept of moral distress in the profession of nursing. Moral distress is best defined by ethics professor Andrew Jameson from the University of Nebraska Medical University. He describes moral distress as a psychological disequilibrium resulting from knowing the ethical action to take, but not taking it due to an inhibiting medical power, structure, or institutional policy. Moral distress is much more prevalent than most people think. Nurses are faced with ethical dilemmas and are forced to make tough decisions every day. Although they are influenced by many different internal and external factors, they must focus on what is right, what is most good for the patient, without doing harm. This is not always an easy job to do. Due to the prevalence of moral distress, there is much research conducted and published which defines the concept in many different ways. One source states that many nurses feel as if they cannot do the right thing. This can result in a decrease in quality of patient care, which affects patient satisfaction and ultimately nurse satisfaction. Nurses can also have feelings of guilt and frustration that stems from poor staffing, staff relations, and ethical climate. Parsons' theory of human becoming is one nursing theory that addresses the nurse's moral commitment. It states that the nurse's moral commitment is to care for the patient in the best way that they can serve them. If this does not happen, the nurse must intervene. This can be challenging for the nurse because he or she may have conflicting feelings, and the decisions must be based on the nurse's values, beliefs, and experiences. Moral distress is common in nursing today and will most likely be in years to come. I will now take it to Abigail Timms, who will explain the purpose, definition, and defining attributes of moral distress.
Thanks, Malie. Abbie here from Bossier City, Louisiana. Today I'm going to discuss with you the purpose and definition of our concept of moral distress. The purpose of this concept analysis is to determine the elements of moral distress. Moral distress must be examined and broken down in order to better understand the meaning and effect it has in nursing. In the past, nurses were expected to simply follow orders and not participate in patient decision-making. However, nurses today are advocating for patients and being involved in the forefront of care, which ultimately leads to moral distress. Now I'm going to discuss the definition. The definition of moral distress is knowing what decision needs to be ethically made, but being unable to do so. When considering moral distress and the ethical component, it has already been identified. Therefore, the focus is on social and organizational issues, as well as where the responsibility lies. Nurses can experience moral distress when what's best for the patient does not correlate with the family, provider, or organizational wishes. Moral distress is when the nurse's internal values and morals conflict with what is required for the external work environment. The level of moral distress can be defined by how the nurse perceives it. Now we're going to look at the defining attributes of moral distress. Defining attributes are the core characteristics that make up a concept and help differentiate them from other similar concepts. Some of the attributes of moral distress include ethical knowledge, courage, and decision making. The nurse must have knowledge of the ethical issue or the ethical decision being made in order to advocate what is ethically right for the patient. One's ethical belief correlates with the personal moral code of what is right or wrong. Moral distress differs from ethical decision making in the sense that moral distress pertains to an individual recognizing a concrete ethical decision, whereas ethical decision making pertains to an individual choosing the best ethical decision for that particular patient. However, the nurse must have knowledge of ethical decision making in order to choose the best approach when faced with moral distress. Nursing courage is also needed in the midst of moral decision making to properly advocate for the patient. Moral distress is a vital component of the nurse-patient relationship. Because nurses are the patient's advocate and must exhibit confidence in their pursuit of ethical decision making, moral distress is sure to occur. And now we'll bring to you the next part in our discussion.
Hi, my name is Christina Mook, and I'm going to discuss moral distress examples and models. The 5 models discussed are model, related, borderline, contrary, and invented. For model, you simply explain the concept as you know it at that given time. For moral distress, we explained it as when a nurse has to make a decision when she knows the right decision morally, but she's unable to make it due to restraints in laws or hospital policies. For related, it's whenever you use different words to explain the concept, but it's the same idea. For related, our example was an ethical dilemma. It's the same idea. For borderline, you use the same words in a different context. Our example was distressed furniture. For contrary, it's explaining the opposite of the concept. Job satisfaction was our example for contrary. People that are satisfied in their job will not be experiencing moral distress on a daily basis. Our last one is invented. This is when you use ideas that are made up and exaggerated, out of the ordinary. These are the cases used to explain moral distress.
Hi, my name is Lane Weibel, and I'm going to discuss antecedents and consequences in relation to moral distress in nursing. Abbie and Walker tell us that antecedents are events, ideas, situations that must exist in order for a concept to occur. With moral distress, in order for it to occur, a nurse must first possess a strong sense of moral integrity, which, as we've previously discussed, is more than simply making ethical decisions of what's right and wrong. Rather, that occurs on a conscious level with deliberate effort. Rather, moral integrity is exemplified by actions of daily living, by how a nurse clinically practices daily. That's one antecedent. Another would be when a nurse actually finds himself in that physical situation in which his moral integrity is either questioned or constrained. One example of this would be that because the nurse is having to obligate much of his time to one patient that may be having, for instance, an acute MI, his other patients may experience a delay in receiving their pain medicine or their meal trays perhaps, and because that nurse is not able to evenly dedicate his time and his attention to these patients, he may experience distress. Now, Avan and Walker continue to talk to us about the consequences in relation to concept analysis. They tell us that consequences are events or incidents or actions that occur as the result of a concept. Now, moral distress is inevitable. Future episodes of it will occur. And so consequences of it for the nurse would be to develop healthy coping mechanisms to deal with these episodes ahead. They can include prayer, meditation, exercise. Additional consequences would be that the nurse may develop and acquire skills to minimize the potential for moral distress in the future. These could include better time management skills, better organizational skills, being able to plan your day or your shift and anticipate the needs, the medications, the procedures, the treatments that will be required can decrease the potential for distress. Being able to refine your hands-on skills so that you can really get those time-consuming procedures done in a more timely fashion, that can decrease distress. Being able to better utilize your resources and delegate and use nurses' aides or additional auxiliary support, being able to more effectively use them can decrease distress. A final consequence of moral distress may be feelings of inadequacy. When the nurse finds himself in repeated conditions of moral distress, he may find that the new norm. Feelings of being beaten down, worn, feelings of this is just how it is. That can lead to future patient compromise and permanence in that feeling of inadequacy. Next, Meredith is going to talk to us about empirical indicators and operational definitions.
Meredith here, and now we're ready to discuss empirical indicators. Empirical indicators are used to define moral distress. They involve the use of both qualitative and quantitative measures, but because moral distress is such an abstract concept in nature, it requires the use of a broad array of empirical indicators. Now, some of the interactions associated or that are observed in moral distress are interactions between the nurse and a surrounding party or a surrounding party, the visualization of, the vocalization of, and the actions related to moral distress. And these actions are many times measured using self-reporting, and the nurse will report feelings of negativity or inadequacy related towards her outward advocacy for patient care. Now, over time, moral distress will create a constant weighing on the nurse. It can yield a change in total nurse demeanor, in attitude, in care, in compassion, or in self-esteem. Such interactions may yield an increase in nurse absenteeism, in resignations, in early retirements, and altogether create a decrease in the quality of patient care that is given. Now next we're going to discuss the operational definition of moral distress. And an operational definition gives meaning and associated behaviors related to moral distress. Now, our operational definition of moral distress is the interaction between the nurse and a surrounding governing body that yields negative feelings as a nurse attempts to provide care. Now, this interaction is expressed through specific interaction, through visualization, vocalization, and the actions with the nurse. To conclude our broadcast today, I want to remind you that in the past, nurses were expected to simply follow orders, whereas today, nurses are a prime advocate and participate in patient decision making. Today, nurses are on the forefront, and unfortunately, moral distress will occur when the nurse's internal morals and values conflict with what is required with her or his external work environment. In order to improve the occurrence of moral distress, increased research efforts are necessary, and that's where you come into play. I encourage you to take a stand for our profession. Be courageous. Challenge the status quo. Don't wait. With your help, moral distress can be drastically reduced. Involve yourself in improving moral distress today.